Good afternoon, everyone. This is the November 15th, 2022 Connecticut Advisory Council for Victims of Crime meeting. We are doing this remotely. And at the outset, please make sure that if you are not speaking, that you have your microphone on mute. Certainly you can unmute if you are addressing the group. The other thing is I just wanted to let everyone know that this meeting will be covered on CTN. We thank them for covering this meeting for us, and we welcome members of the public who are watching the work that we do. So, like I said, it's 3:03. We're calling the meeting to order. I did want to just remind you, on the link for the meeting was the agenda. And there were also the meeting minutes from our October 4th, 2022 meeting. So you should have those materials. We'll be following that agenda. The first order of business is to approve those October 4th, 2022 minutes. Do I have a motion to approve?
So moved.
Okay. Do I have a second?
Second.
All right. Any discussion on those minutes?
I had one thing to change. I was not listed as in attendance at the meeting. I do not take it as a slight, but it would be nice to be added to.
Absolutely not. We will add your name to members in attendance on that date. Thank you.
Thank you.
Any other discussion about those meeting minutes? All right, all in favor of approving them?
Aye.
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 Right. Any opposed? Any abstentions? All right, those meeting minutes are approved. So our meeting today is going to be relatively short. We have on the meeting agenda, item number 3 is the statutory charge. Most of you were with us at the last meeting, and at that meeting we had just gone over sort of the statutory authority that gives us the ability to meet. We talked about that. That's Connecticut General Statutes 54-203. That requires to meet at least 4 times a year. Today is our 5th meeting this year. The next step sort of in our statutory charge is to provide the report to the Chief Court Administrator. That's our annual report. That has to be submitted to the Chief Court Administrator before December 15th of this year. That is being prepared and will be submitted to the Chief Court Administrator. So just wanted to go over that. The other thing is you had been provided, and we talked about this at the last meeting, but some of you were not there, the materials with regard to our council, those meetings and the statutory provision that I just spoke about. All that information was provided to you via email. And so if you want to refer to that at any time, you should have that. If you don't know where that is in your inbox or your deleted items or your saved items, please let Jean know so that she can send you another copy. We used to send it by a hard copy, but we did send it via email. I see, Linda, you had a comment question.
Yeah, Judge, thank you. We have a couple of new people on who I don't think know us all. So might we go around and introduce ourselves before we jump into the statutory charge?
Sure. We tried to do that last time. It was a little, it's a little counterintuitive, but we can kind of jump in. It's hard to do it remotely, but we're going to give it a shot. So thank you.
I apologize. I wasn't here the last time.
Yeah, no problem. So I'm Laura Baldini. I'm a Superior Court judge, and I'll hand it off to my co-chair.
Hello, everyone. Yvette Young from the Village. I'm co-chair for this advisory committee. I'll hand it off to Linda.
Hi, Linda Semino, Director of the Office of Victim Services. I'll hand it over to Andrew.
Andrew Woods, Executive Director of Hartford Communities That Care. Glad to be here. And I'll hand it over to Ebony.
Good afternoon. Ebony Suggs with the Department of Correction Victim Services Unit. I'll hand it over to Lee.
Hi, I'm Lee Ross. I'm Deputy Director of External Affairs for the branch. And I guess I'll hand it over to James.
Hi, I'm Jim Morgan, Program Manager at the Office of Victim Services. Hand it over to Amy.
Thanks, James. My name is Amy Lupoli. I'm the Senior Director of Clinical Services for Klingberg Family Centers, representing children and behavioral health services. Oh, and I will hand it over to Yvette.
I went, so I'll tag Suzanne.
It's like a tag team. I love it. Some people call this popcorning, which is what we're doing. We're popcorning around. So I'm Susan O'Villian. I'm an attorney. I'm also a homicide survivor. I do workshops with women who've come through domestic violence and sexual assault, helping them go from victim to survivor to thriver. And let's see, do I see anybody else here? Oh, Nilda's here from Connecticut Legal Services. Nilda?
Hi, yes, I'm here. Nilda Havrilla with Connecticut Legal Services. I'm our Litigation Advocacy Director, and I'm subbing today for Debbie Witkin, our Executive Director. Thank you for having me.
Great.
Is there anyone else who has not introduced themselves?
Judge, there's somebody on the phone.
So that could be somebody who's not on the council or a member of the public. So we've introduced ourselves. We've talked about the statutory charge and the materials that all of you should have and be able to reference along the way. We have the next item on the agenda, which is the victimization survey update, if there is one.
Thank you, Judge. There is quite a lot to report on the survey outcome, and if it's agreeable to you, Yvette, and the rest of the committee members, we may want to spread this out over a few meetings to let it all, to give each and every section its due. For those of you who don't know, the judicial branch, on behalf of the Office of Victim Services, entered into a contract in 2021 with Market Decisions Research to conduct a statewide victimization survey. The survey had 3 goals. One was to establish a statewide baseline for crime victimization. The second was to understand barriers that prevented victims from receiving services, and those particularly victims in historically underserved communities. And the third was to provide a focused understanding of victims' needs so that limited funding can be directed to the most significant and pressing statewide needs. There was a report out of the materials at the end of June, and Mary Kazicki, the Deputy Director, and I have been working with a statistician, policy wonk from OPM, to help us go through all of the raw data, which is quite overwhelming. But I can tell you some of the highlights of the survey. It was divided into 3 phases. One was what they call a mixed mode push to web methodology. Don't I sound like I know what I'm talking about? Which included invitation letters, online surveys, and telephone surveys. And the first part of this project was to conduct the actual survey. We sent out 11,990 surveys with 1,230 people responding. That was a response rate of about 10%. Which the vendor thought was fabulous. according to the Pew Research Center, a 6% telephone survey completion rate is outstanding. So we did far better. We did better than that. So I was very happy about that. Second phase of the 1,230 individuals who took the survey, 140 stated that they would like to be interviewed further. Of those, the 140 were contacted by email, letter, and phone call. Of the 147, 39 sat for an in-depth interview, which lasted between, I think between half hour and 90 minutes. And then the third phase was working with OVS. MDR contacted various groups of professionals for work with crime victims in Connecticut. And of the individuals who were contacted, 25% participated in one of 5 focus groups. So those are the big sections that, if it's okay, we'll talk about over the next couple of months. But I think, you know, our bottom line for this was to develop baseline data. A survey for victimization in Connecticut was never done, hasn't been done before, I think, and based on that very first goal, some of the stats I'm going to give you are reflective of this baseline, beginning to have the baseline data. I can say that, I mean, some folks who have heard the number of participants said they wished it could be more, but the way the survey was implemented, the demographics that were collected, such as race and ethnicity, age, household income, gender, and education attainment, when those were looked at in comparison to the American Community Survey, which is part of the census, our numbers were very reflective of the state of Connecticut. So that when we are able to do this on a statewide basis, we will be able to say that X number percentage of victims of Connecticut were X. So we're very excited about that. Just some data. The most reported victimization happened in Hartford, with 16% of respondents saying it happened in Hartford and 15% saying it happened in New Haven. And let me take a step for a second, that those of us who are in victim work, we've known a lot of these stats for a long time. It's just nice to have them quantified. 37% of violent and nonviolent victims reported that their victimization happened at home. Hi, Mark. The 16% reported that the violent crime occurred at a friend's, relative's, or a neighbor's house. And not surprisingly, 14% of nonviolent crimes happened online. So that gives a complexion of, again, 2 of our most, the cities with highest populations and significant other demographics, as well as how violent crime, the issue of stranger danger doesn't really hold anymore. If it ever held, I don't know. But with most violent crimes being perpetuated, by someone they knew. Of the, and before I go forward, I just want to thank Mark for allowing us to work with Kevin, one of his team members, whose title I don't know, Mark, but he's been fabulous in helping us wade through all of the various data.
It's our pleasure, Linda. Yeah, Kevin is our Statistical Analysis Center Director, and he's thoroughly enjoyed partnering with the Judicial Branch OVS in reviewing the data. Although the presentation generated from the survey was expansive and rich in scope, clearly there's substantial data that accompanies that involves significant analysis. So it's been a real pleasure to partner with your office, Linda, on it, and hope it's been helpful in generating some of the analysis. Judging on what I've heard so far, you've done extensive work to unearth a lot of this information to help us better understand the impacts of victimization in our state.
Absolutely. It's very exciting. I know you stating percentages is a little dry, but again, it gives a scope of the experiences. 58% of the respondents identified as direct or indirect victims of violent crime. 63% identified as direct or indirectly impacted by nonviolent crime. And we had this odd category which called other, and it was those who didn't answer any of the questions as presented. They used their free text, and 17% of those individuals identified as either direct or indirect victims of crime. I think the piece that helps OVS as the state's lead agency dedicated to providing services to victims of crime and our funder partners really helps is that in violent crime, 28% identified being victims of harassment or threats. 25% identified as being victims of domestic violence. 24% were identified as victims of physical assault. 17% identified as victims of sexual assault, and 12% reported being a victim of child sex assault. So that's, I know we often, in my world, domestic violence is one of the most funded services through our VOCA assistance funding, but when you hear of harassment and threats, it's embedded in some of our work, but I don't know, I know from OVS we don't have anything specifically geared to that population. And in nonviolent victimization reported, 28% reported being a victim of vandalism, 25% reported being a victim of identity theft, and 22% reported being a victim of theft or larceny. And again, when you look at the services that OVS provides, or statewide, what we fund through, again, the VOCA assistance grants, there is not many services for individuals of these crimes. One could say vandalism, you know, it's your insurance can cover it. But what happens in communities where people can't afford insurance? I mean, these are, we think of these as non-economic crimes, but there's certainly an economic and impact based on what kind of the reason for the vandalism. Identity theft, those were individuals, many of them took part of our individual in-depth interviews, and they spoke at length about the devastation of having their identity stolen, having bank accounts cleaned out. So again, we don't have anything specifically here for that, but it's giving our implementation committee really think different ways of looking at things. And theft and larceny, you know, was there a criminal case? Was there restitution? Would it be ordered? And if restitution is ordered, would it be paid? So the financial side of the nonviolent crimes really came through to us. The again, this other category, 15% being a victim of DUI and they made the judgment not to put it into a violent or nonviolent. This was the participant just putting it into another category. And in the free text, none of above that I mentioned a minute ago, some of that encompassed, and we did not merge these because we kept the identification that the survey participant used: credit card theft, injustice from police, discrimination due to disability, petty theft, and stalking. So we have a round scope of what they, the victimizations that they considered other. And so, and then the one that I think had taken all of us back in a reflective way and how this reflects on our work really is the victimization as reported by the participants. So 43% of the respondents who took our survey reported experience one victimization. And this is where it gets, I think, challenging for us as victim services providers to figure out what our next moves would be. 20% reported being victimized twice. 18% reported being victimized 3 times. And 19% of the individuals reporting that their victimization was ongoing. So if you combine even the 3 or more times with the ongoing, we have a very significant percentage of the individuals who took this who are stating that they have been victimized on an ongoing basis. And when you link that with the lack of reporting to police, we begin to see the picture of a pretty significant group of individuals who are not reporting by their own admission, and who are also reported that they don't necessarily know where to go for help. So that is a grouping, and we've begun to have some conversations among ourselves of how do we really look at the re-victimization? How do we help the individuals have contracts through the VOCA assistance? How do we help them, or how are they looking at repeat or poly victimizations? And how can we maybe as a state have that conversation of how we can potentially address those needs? I'm not saying in a better way, but there are folks who are missing the service delivery system in Connecticut. So we've had those statistics for violent crime. For nonviolent crime, only 4% said that they were victimized on an ongoing basis, and 1% said they were victimized. The other group were victimized on an ongoing basis. And I just wanted, because again, I could go on forever, but I know there's other things you want to discuss, but I think what's really interesting is that there was a table in the difference between nonviolent and violent offenders. For instance, 80% of those who reported being a victim of a nonviolent crime, their perpetrator was a stranger, where 26% of those who said they were victim of a violent crime reported that the perpetrator was an offender. Was a stranger. With the 11% of individuals who reported domestic violence or spousal abuse, all of violent, they were all, people who reported a spouse or partner abuse, 11% said it was violent. Nobody reported nonviolent that. I'm losing my words, I apologize. And 17% of the violent crimes perpetrated by a boyfriend and girlfriend were violent versus 2%. So the stranger for the nonviolent crimes and the perpetrator being someone known to the victim really came through with this. Again, it validates what we've known anecdotally through our work, but now we have, again, the basis of pointing this of the statistics giving us the same information that we've known anecdotally. So, Judge, I tried to keep this to about, in Yvette and the council, I tried to keep this to about a 10-15 minute report. Again, I could go on for hours, but I think I'd stop there before I just kind of overwhelm people with so many percentages. And I don't know if there's any questions to these.
I had a quick question. In regards to the threats and harassment, were those occurring within the context of the domestic violence and sexual assault cases, or they were completely separate from those two particular forms of violence?
It could be combined. So if that, we had 27 crime types under the first question, And for individuals who were victimized a second or third time, they could go to the second question, which was the duplicate list of the first, and then identify again.
Okay.
So you could have a victim of domestic violence answer domestic violence in the first question, and then do harassment and threats in the second. But this is one of those, the answers to, I almost wanted to put it up behind me. The answers to the second question, which has the repeat answers, it's probably 5 feet long.
Wow.
So, and this is where Kevin has been so great of helping us take these and really begin to pull them out and understand them. So hopefully sooner than later, those are the kinds of questions we will have the answers to. So I know CCADV has already asked us to kind of synthesize some of that. We will be able to provide that information. That's the ultimate goal.
Okay, excellent. Thank you.
Does anyone else have any questions? I know, Linda, you said you have a lot to report. In terms of our next meeting, what are some of the things that you would like to cover for the council?
Well, there's a couple of other highlights, Judge, in regarding the survey, and then which I think I could cover. And what might be easier is that I send these out. So instead of me listing statistics, people can review them ahead of time, and I can certainly work with Jean on that. But I'd like to really then move into going over some of the experiences that they've had. You know, people really reported, the survey participants really reported out on how well their needs were met, both in a laundry list of like victim compensation, medical. And then I'd like to move to really sharing you some of the highlights of the in-depth interviews. So I could probably do that at the next meeting, which is in February. And then if it's okay with the council, I could in April, I can talk about the findings of the focus groups. And then that will, over these next couple of months, will give the group a comprehensive look at the whole survey.
That'd be great.
Thank you.
Great. Anything else on the victimization survey? All right, I'm going to turn the meeting over to my co-chair.
Thank you, Judge Baldini. All right, so at this point, we're going to move forward and have a conversation, or maybe it's more of an update from James on the Victim of Crime Fund, where we are at to date.
Okay, thank you, Yvette, and good afternoon, everybody. Yeah, I just want to give a brief update on where we stand with the Federal Victims of Crime Act funding. The OVC director had our monthly phone call last week to give an update on the fund. The federal fiscal year ended on September 30th, and she reported that deposits into the fund for the year totaled $822 million. This represents a 6% increase compared to the previous fiscal year, which is a good thing. But she also wanted to point out that in September, only $8 million was deposited compared to $280 million the month before. So while revenues may be going up from the prior year, there is no consistency from month to month on what's coming into the fund. The fund balance in the fund as of September 30th is $1.5 billion. That actually represents a 25% decrease compared to the previous fiscal year. And so that's where the fund was starting with the new fiscal year 2023 as of October 1st. The president's requested allocation for the current year is $1.75 billion. So that leaves a difference of $250 million that'll have to be covered with current year revenues of the fund. The federal budget currently is operating under a continuing resolution, I think until mid-December. So the cap hasn't been finalized, and OVC doesn't know if the president's request is going to change based on the revenues, or if it's going to stay the same. They also do not know what the impact is going to be on budgeting in future years because they're kind of relying on current revenues to fund current expenses, which they haven't had to do in the past, or at least not in the last 10 or 15 years. So she will keep us posted. That's really all they have at this point. And we'll keep the council posted as we hear anything new about what's going on with the fund.
Thanks, James. Anyone have any questions for James related to this matter? Nope. Okay, thank you, James. So we're gonna move on, and actually, one of the conversations I wanted to have, or we wanted to discuss under collaboration, was around data sharing. I think the last meeting, Beth Hamilton had mentioned, how do we collectively share data so that we can start to have a narrative to be able to go to legislators for conversation about what does victimization look like in the state of Connecticut. So in line with what the victim survey, so what Linda just discussed with us, and this idea around funding and what that's going to look like in another year, the conversation that I wanted to just start, it doesn't mean that we're going to make any decisions today, but just have a conversation and hear from the providers. What would data sharing look like? How impactful do you guys feel that would be? And what kind of information would be important to be gathered that would be able to help us have comprehensive conversations about victimization, not just only in your wheelhouse of the work that you're doing, but across the state and across different forms of victimization. So just wanted to open that up for conversation. Any thoughts, ideas, or feedback in regards to this process?
Do we have a list of what people do collect in each agency or each organization? Do we have an idea? Is there a clearinghouse for that, or is there a place where it would be repository? I don't know the answer. I'm just asking the question. That would be the first question I'd ask. Is anybody already collecting this information?
Good question.
Somewhere?
I know that for our programs that are funded by VOCA, we have to report out on statistics, I believe, quarterly, as they pertain to what the scope of services that we are trying to achieve through the services that we have. And that's reported out to the victims of crime as part of our relationship with the funding. Where that goes from there, that I don't know.
This is Mark.
Jim. This is Jim. I can jump in on that. All of our service providers, as Amy mentioned, do provide reports to us quarterly on the number of victims that they're serving, the types of crimes that those victims are experiencing, and that the services that each agency are providing. We collate all that information. We report it to the OVC on a quarterly basis, and it's also used to generate an annual report, an annual summary report for all the VOCA funded contractors in Connecticut. So that information we do have on hand, and the demographic information, if I didn't mention that, of the clients as well. So that information we have for our service providers.
I can't remember, James, but has that ever been shared with this advisory council? That data? The summary?
I don't remember in the past if that's ever been distributed, the annual OVC report. We can certainly do that once it's filed and finalized.
Yeah, because I think as Susan is trying to sort of indicate, if there is already a place where all this information is being captured, then it would be helpful for that then to be able to be shared, so that if, as we said, we're trying to do a collective advocacy around a particular issue, everyone understands what the data points look like in all the different service provisions, right? It's a stronger conversation. When I think about it, we can have conversations about victimization, but usually it's through the lens of the work that we are doing without thought to sort of the intersectionality, because there's victims that oftentimes are victimized across different crime types. And then we're not able to sometimes have that narrative or conversation to make it robust. And I think going into a season, a legislative season, understanding fully the breadth of victims in the state will be important. And not only that, if we're going to have to ultimately advocate for funding for victims of crime, it creates a stronger narrative if we understand what this looks like, not only in our discipline, but in other disciplines as well. So we could be stronger allies to each other. So if that is a resource that's available to us that could be shared, that would be great. Any other comments or feedbacks on the data sharing piece?
The other thought I have is that, I mean, so it sounds like most of the data that the agencies collect is about the services they provide and to whom, the number of victims they served. I think if I remember correctly, Linda, on the needs assessment, we were kind of shocked by the fact that many victims said they didn't know about services, they didn't go to services. So there's kind of a disconnect between the two things. I'm not saying that we can connect it, but it'd be nice to at least get a little better sense of that, because somebody somewhere is going to say, well, you guys aren't doing your job. Where's the data? Based on the needs assessment, based on those people who genuinely did not know there were services, but it wasn't that we didn't. So I don't know if we're collecting, if more people are, so is it the collection of data about the victims we served or how many we served versus how many victims are out there, or somehow the connection between those two plot points that people would want to know most, particularly in terms of funding. So are the services not, are the victims not being served because there's not enough services or because they don't know about them? Once again, I don't know if there's a question we can answer there, but that would be the tangle when we start to get this data out there from the needs assessment.
I think Susan, those are all questions that I think we're going to have to grapple with as we look at what data we do have, and probably we'll be able to have more of a concrete response to that. Others on data collection, data sharing, are folks comfortable with this part of the conversation? Providers that are on, are you guys comfortable having this conversation around looking at the data from all the different disciplines?
I think my question, we appreciate the OVS sharing that there is information submitted to the federal government under the grants, but I'm wondering that is probably formatted in a way that responds to the federal government's interest in knowing sort of oversight and administration of the grants. Does OVS have any insights as to whether that information will be intelligible for the advisory council's purposes? For example, trying to gather a wider view of service delivery to victims. I just having never seen that information before, I wondered if OVS could perhaps help us to anticipate what format and that information might be provided.
Well, the performance, and I can certainly have Jean send out the performance report. Basically, it'll summarize the quarterly data that each agency has. It'll there's some narrative questions. There's also everything is in total. So for what each 45 agencies, the total number of people served, the total by crime type, and the demographics. Realizing that there's overlap because multiple agencies may serve the same people as they refer them to each other. So there is that to take into consideration. And there's also, it's limited to, it's the people they served under the VOCA project. So we won't know, we don't have the data for all the other services that the agencies may be provided to these same individuals, just with other sources of funding. But it's it's basically chart information. It really won't identify specific agencies. Everything is just wrapped up in cumulative totals. And we can certainly send that out to review and to see whether or not it would be helpful or not.
Makes sense to me. Thank you very much.
Any others, feedback, comments in this section? Okay, so we'll take a look at that data, make a decision about what conversations we need to have or should have around this moving forward. So with that said, this is the section around collaboration. If you were not on the last call, we added collaboration and good news to our agenda as a ongoing agenda item. And in this section, we're asking folks to just share collaboration efforts or initiatives that they're working on. If they're working together with another provider on a particular grant or work, to give us an update on what that looks like and what's going on in their work. So I'll open it up now for anyone who would like to share any collaboration opportunities that they're involved in.
Yvette, I'll start with some of the things that we're continuing to do is work with other hospitals and CBOs that are doing HVIP work, but also other CVI, community violence intervention programs across the state of Connecticut, locally as well as across the state of Connecticut. And so even going back to your question around data collection and looking at what could be pulled together, clearly there are, when I think of some of the groups that do the CVI work, that we're all building up our infrastructure, if you will, around collecting different types of data and data that we can share across programs that do CVI work. And so those are some good developments that are in play. Also with the recently established Commission on Violence that at the Department of Public Health, there'll be a report that will be submitted to the legislature at the end of this year. And folks that would like to submit any recommendations to that committee, actually have a list. Probably less than 2 weeks to do so, but that doesn't mean there won't be opportunities to continue to engage in that process. But we're really looking for, and when you talk about collaboration and partnerships, we're really looking for as much information as possible to help us put together the best programmatic policy and funding recommendations to lawmakers along those lines. So there again is some promising opportunities collaboratively with some of our partners here locally and again across the state. And so those are some good things that are happening. And then, of course, I'm always proud of the work that we've been doing between DSS and judicial under Linda's leadership there at OVS with the Medicaid piece and connecting the dots between those two on how we can continue to support this work between different funding streams and approaches. And so that's what comes to mind with me.
Excellent. So what, Andrew, would folks need to, how would they connect with you? What kind of information would you be looking for as far as recommendations or suggestions? How can this council help to feed and inform? Because I think, what you're talking about is what we hope this sort of council can do is how do we help understand what folks are doing in their particular areas? How are there opportunities for, collaboration, partnerships, and how do we share information in a way that allows for the greater good, right? And for there to be, more of a presence of the collective group working on this, not siloed groups depending on what the victimization is. So if you could just share a little bit about what that process would look like, what would you need as information so that those who are listening or who those are missing could read the minutes, could offer up to you to help in that process.
Well, certainly, I think, in relation to the silos, that is a part of our work, unfortunately, because of a variety of different reasons, rather politically or because based on the funding. But that being said, there is still opportunities. Give an example, though the commission that's been established at the Department of Public Health is specific mainly around community violence intervention programs, there is still discussion being had around domestic violence, around sexual assaults, around, those other victimizations. And though the committee, again, doesn't necessarily focus, say, solidly on those areas, they still do want to hear from providers and those that work in those spaces. because there is a intersection. There is a connection between all of this, as discussed in the survey, in the report that we received here with this committee. And so I would say that we still channel that information up even to the Department of Public Health, that just because someone said it's around CVI, then I would say in one respect, ignore that. Because at the end of the day, come the next legislative session, we all need to be up at the state capitol and in the halls of Congress saying, you know what, folks, this is what this thing looks like here. And I don't care whether it's in an urban area, suburban or rural, this is what it looks like. And we're all in this fight together. And we need to recognize what the true need is and what folks are saying that what it's going to take to what's going to be required. And so that's really the only way that I can address your question, at least for right now, Yvette, is to say that, you know, I would say that we continue to have these conversations, continue to submit information to these bodies, these deliberative forums, and again, just keep advocating along those lines.
Sorry, I'm gonna ask another tangential question, Andrew. Who are members of that commission? Like, who sits on that committee, and how does individuals get access to being a part of that committee if they're interested?
Absolutely. Certainly, I would say contact first and foremost the Department of Public Health. Susan Logan primarily would be the person I think you can reach out to. The DPH commissioner does chair the commission, but some of the staffers on that commission, one is Susan Logan, and then I believe another young lady by Colleen, and I forget, lose her last name at this time. But I would say reach out to the Department of Public Health. Just as this is being broadcast through CTN, so are those meetings as well. And that's an opportunity for folks to peek into the room or look at the video and get a sense on, you know, what the discussions have been. And then also you'll get a chance to see who else is around the table. There are like a dozen or so folks who have been appointed by the legislature and the governor. And I can list the names off, but I'll send the names out to this committee on all the different players. And primarily they are those who are in the space of community violence intervention programs, a couple of folks that do research, and folks that represent hospitals.
Excellent. Thank you, Andrew. I didn't mean to put you on the spot and ask you 21 questions, but I appreciate your feedback in that. And I think, you know, this kind of conversation and this moment of sharing helps us to understand the bigger picture and the other work that's happening that we can all partner around. So I appreciate you sharing your collaboration efforts today. Sure. Others, any other collaboration efforts that anyone would like to highlight in today's meeting? Do we have any other, because I can't really tell, but any other providers that are with us? Because I think we're missing a few of our key provider folks. Just in case I don't want to miss anyone. All right. If there isn't anything else on the collaboration, as I said, this is a standing agenda item. So we're asking folks, you know, in between the meetings, think about it. Jot down, remind yourself to, you know, highlight your collaboration efforts and partnership efforts when you come to this meeting. So it's going to be an open forum conversation. So we just want to encourage, we know it's new, so people are still wrapping their heads around it, but just want to make sure that we encourage you to come and share what your experiences are and who you're working with to the council. So the other piece of this is good news. Anyone has anything that they're celebrating, any new grants, any successes, even a client success story, anything that you would want to share as good news with the group, this is your opportunity to do so.
Yvette, I know if this is a good news from the Office of Victim Services point of view, probably 2 months ago, one of my team members walked in with a stack of annuity reports that related back to the 70s and 80s. And we had a conversation about how to proceed on that. So our colleague, Rachel McKnight, and I took this on, and there was $140,000 invested for these, I think there were 15, 16 people when they were children. And along these years, the money was forgotten about. And Rachel has done amazing work with 3 annuity companies and the annuitants themselves. And we have transferred all of that money to them. And one of the annuities was worth $5,000. Another one was worth $33,000. So it was a fair amount of money. So that felt good that that money is hanging out with OBS for a while, and we were able to reunite that. So that's one of the things I'm really proud of that happened lately, and I just wanted to share it.
Thanks for sharing that, Linda. That is good news, and I'm sure those family were really excited when that check showed up. Talk about an unexpected blessing. So thanks for sharing that. That's really good news. Anyone else? Good news. This is our time to celebrate each other and the work that we're doing. So any other good news? The silence feels as dark as it is outside right now. Just thought I'd put that out there. All right, if there's no other good news, going once, going twice. All right, save your good news for February, but we're gonna hope to get some more when we meet again in February. The last piece of the agenda before we adjourn is talking about presentation. And as I said, I don't see too many of our providers on this call, so this might be a conversation or a few phone calls that has to be made in between sessions. But we do want to go back to doing presentations in these meetings and hearing from providers what they're doing, any new service provisions that they're offering, anything that is related to victims of crime, and having us understand the work that they're doing. It's a great opportunity to understand programs for referral purposes. It's a good opportunity to understand what other service provisions look like across the state. So we are going to ask, if you're a provider that's on today and you're interested in doing a presentation at a future meeting, please do feel free to throw that in the chat, raise your hand, let us know so we can start to decide who we would put where. If you want some time to think about it, that's fine. We'll try to reach back out. But it is important for us to continue to educate ourselves about the work that is being done in the state. So just want to make sure I put that out there. So I'll pause. If anyone wants to jump in and says, yes, sign me up, I'll do the February meeting, then that would be grand. Okay, who was that just said they could do a presentation? Sorry, I'm trying to read the chat.
It's me, Amy. I don't mind doing a presentation in February. I feel like that's
Excellent.
a nice chunk of time to think about it.
Yeah. Thanks, Amy.
No problem.
Anyone else interested in doing a presentation? Go ahead, Andrew. I see you on mute.
Yeah, you can go ahead. If you're going to do 2 at that time, then you can add me to it as well. By then, we would have quite a bit of information to report back out on in terms of what comes out of the commission, and that has been presented to the lawmakers.
Excellent. That would be great. I'm gonna bring some speakers in, but I'll definitely coordinate some presenters for human trafficking. Right now, we have the Hartford Task Force that is up and running. They're doing their kickoff in November. November 30th, actually. And so I'll see if they're a viable option to come in and talk about that innovative, it's a grant that they wrote for sort of task force approach to human trafficking for the Hartford region. Or, look at some providers who can come and talk about the adult side and the child side as far as services. So I'll work on that. I'm not sure which month because I have to coordinate with the speakers, but I'll definitely ensure that next year we have a discussion on human trafficking. Anyone else? So this will be in the minutes. We'll ask again next meeting or reach out to folks to see who might be interested so that we can have at least a presentation for each meeting that we have in 2023. All right, folks, look at that. We're doing really good. With 4 minutes to spare. So those are all our topics, unless someone has anything else they would like to share, any upcoming events, because that's the other thing that you can report out under good news. Is there a conference, training, anything that you want to promote or allow us to understand what you're doing so that if we can sign up or, spread the word, we can do that. So any events, upcoming trainings, anyone wants to highlight? Could be through OVS or it could be through a provider. Go ahead. Did you just clear your throat or were you trying to speak? It's a person with the phone number, so I don't know your name.
Oh, I'm sorry. It's me, Irene. No, I was just clearing my throat. Pardon me.
Okay, no worries. All right. Well, take that into consideration. Actually, I have a potential plug for January because we're not meeting again until February, and I will send that to this group. I'm working on doing a presentation that I developed on race, racism, and human trafficking for Human Trafficking Awareness Month because January is Human Trafficking Awareness Month. So if that comes to fruition, I'll definitely send that information out so you guys can have that. It will be free for anyone who wants to participate. So I'll make sure that information gets out with registration information at some point, probably in December. Just wanted to mention that. And if anyone is doing any HT related, human trafficking related events in January, we'll encourage you guys to share that information as well. All right. There's nothing else, then do I need to do a motion to adjourn or we just end it?
Should note.
I don't think the last time we did a motion. So if we don't need a motion, then thank you all so much for participating. I look forward to our discussion in February. Looks like we're going to have a very robust meeting agenda. So we may go past an hour for the February meeting, but we'll get you guys those details closer to that date. All right. Be well. Enjoy your weekends. And also happy Thanksgiving when it gets here.
Thanksgiving, yes.
Thank
you.
Thank you.
Bye.
Bye,
Thank
everyone.
you. Take care, everyone. Bye-bye.